So we are back from that long break. It's been a while. Yes, guys, do you know what happened? ECG didn't allow us to work for 2 solid days, but we are back. Today I'm going to bring the stories to you back to back. So stay with me, don't go anywhere. If you haven't subscribed to the channel, kindly subscribe, put on some post notification to receive our notifications. So my name is Nadia Agodi. So the first story that I'm going to walk you through is we realized that during the week Tamale Teaching Hospital was in the news. The health ministry was in the news. The health minister himself was also in the news. So this is the story. A patient was transferred from one facility to Tamale Teaching Hospital, and unfortunately, the patient died. The patient passed on. So it got in the news. People started talking that the doctors and the management of the Tamale Teaching Hospital, they are not doing their work properly, and due to that, and a patient, every year. So it was all over. It was in the news. People were talking, dragging the hospital. So the hospital released a statement. First of all, the hospital released a statement telling the public that what we are saying, that is not the story. According to the hospital, as they brought the patient to the hospital, the patient needed some intensive care. And what they needed to take care of the patient, they don't have it. They don't have it. And according to the intensive unit beds now, Tamale Teaching Hospital, it was just 6. And at 6 now was occupied. So they didn't get anywhere to detain the patient. And that is why the patient died. So as the rumor was going around, the people were dragging the hospital. The minister himself decided to pay the hospital a surprise visit. The minister went there to check what is going on in the hospital. What are they doing in the hospital? Fortunately, when the minister got there, the CEO for the hospital was there. As he got there, they told the CEO for the hospital and the minister and some people, they toured the hospital checking around, and they realized, say, a lot of things are going wrong in the hospital. So according to them, their water is not flowing. They need a lot of things, and they are not complaining. So instantly, then they said, Master CEO, we don't know what you are doing here. You are here. The hospital needs some things to work, and you are not saying it. You are not telling anybody. So assuming, say, the health minister didn't go there, or the person didn't die. A room on the internet and the health minister decided to visit there, check what is going on at the hospital, and they don't know anything. So then they said, Master, go and sit at home. Go, continue. And the surprised one that all of us, we don't understand is that as soon as they sack the CEO, they appointed a new CEO. A new CEO was appointed. The next day now, a new CEO was appointed. So, people were asking, is it a sentence or what? Is it sentence? Is it something that were planned, that this is what we want to do? Because I was asking, so the new CEO that they appointed, no interrogation, no, I know say if they appoint you for some role, you need to, sit down, interview you to see if the person qualified for the job or something. This one is not like that. Pana new appointment. So as the minister was at the hospital, the minister realized that a lot of things are not going well at the hospital. So he decided to, speak to one of the doctors in the hospital, asking the guy 1 or 2 questions, why the patient died and all that. So the guy was trying to express himself. The guy wanted to explain to the minister why the patient passed on. Then the minister vexed. He vexed that the doctor wants to challenge him. You watch this video.
The call was made. The 4 vents were in use, so there was no extra vents anywhere to put the patient on. So that was the issue that kind of caused the delay. But all the resuscitation was done here. We called the ICU, and they said they didn't have any vents available for the intubation. And at that point, there's really little that you'll be able to do without the intubation. So the patient was being bagged here until the patient could.
So when the patient got here, how many minutes did they get you to assess the patient?
Oh, within 10 minutes, because usually when you score red, you are immediately brought to the red zone. There is no situation where you have to delay. You are pushed straight to red. So as soon as you are tried red, you are brought in there.
And then, when did you communicate with the ICU when they told you they didn't have any ventilator?
No, I think immediately we identified that the patient needed to have been intubated. The ICU call was made.
And they said they didn't have any
Yes, so there were no available beds.
So if somebody tells you that at the time they got to know that there was a patient like that, there was an available mobile vent, how will you take it as a man in charge?
I mean, if there was an available mobile vent anytime, we would have used it. We
Because you
take
see,
patients here all the time.
There's a bit of conflict between what you are telling us now and what they are also saying. And so it is either an issue of lack of proper communication or there's a problem somewhere. Either it is an issue of proper communication or negligence or somebody's lying.
I mean, it's a straightforward case. Patient came, assessed, needed to be intubated. There is no vent at the emergency as we speak. There is no functional vent. So the next step is ICU. The call was made to the ICU.
And they said there was no.
They said there was no space. That was the communication we got.
They heard what the officer was saying. So we have a mobile vent there, and then they spoke to the ICU. The time that they came down to assess and then planned to bring the mobile vents down, that was the time that the patient arrested. So he probably had a stroke in the same way.
So from this, I do not want to go there. No, go on.
I didn't get the impression that doctors now created for this narration up there.
No, that's
That
fine.
is why I made the point that it may be negligence, because clearly
That's fine.
if there was a mobile vent there at the ICU, maybe
If the communication was done at the right time and there was available mobile vent, let's leave it at that. So let's leave it at that.
Come again?
get similar cases.
Occasionally it does happen.
That's what it
Yes, occasionally it does happen. I think the way forward is for us to have the vents available at the emergency. And then this wouldn't have even happened because we could have intubated the patient without needing to call.
I said that what I'm going to say, I said it when I went up there at the ICU. You know, how you handle patients, even if the unfortunate happens, it gives them some kind of comfort. Okay? If the patient. That's why it's blown up.
No,
Can
no.
you imagine if it was related to
You are not also understanding
If
me.
you have that mindset, you will get the impression wrong.
You are not understanding me. It is not.
I told you to keep quiet, and you are behaving in front of me. So you can imagine how.
I'm trying to explain.
You can imagine how.
I'm trying to be
I mean, with this attitude even to your superior, can you imagine how you deal with common people? And that's why it creates the problem. That's what will create the problem.
So this is what happened between the doctor and the health minister. So people were dragging the health minister. In Ghana here, we don't understand why if you want to express yourself to an elderly person or somebody ahead of you now, you don't respect. But when I watched the video, I didn't see where the doctor said something wrong to disrespect the health minister. But that is what the health minister vexed. You watched the video. The guy was just explaining himself that this is what we need. If Ankaya was her, Anka, they don't think that the patient will die. Now he vexed. So that is what happened at the hospital. After that, and a lot of things went on. I'm going to bring you the next episode. The doctors decided to go on strike. Patients stranded the next day. Now the doctors released a statement saying that they want the health minister to come and apologize. And yes, Anna, they will advise themselves. After the statement, they also stated some things that they need. That if the government and supply those things now, they are going to advise themselves. So yesterday, some scenes from the hospital, we realized that patients at the hospital, they were stranded because no doctor to take care of, no doctor to attend to them. They were just stranded at the hospital. So I'm going to bring you break the next episode down, what is happening at the hospital right now, the statement that the Doctors Association of Tamale Teaching Hospital released. And right now, the minister has come out with an apology to the doctors and some items to be donated to the hospital. Bravo. Yes. So that is what happened at the hospital. I'm going to bring you the next episode on other things that is happening at the hospital right now as I'm speaking to you. Thank you for watching this episode. If you find the episode interesting, subscribe. I'm out.